this is a conversation I'm very excited to have. Toby, thank you so much for driving down from Indianapolis to come visit with us, have this conversation. Again, I'm with Toby Kelly, the BIM manager from Indiana University Health, Design and Construction Department. Thank you so much for joining us.
Yes, thanks for having me.
You want to start a little bit with just about yourself?
Yep, sure. So I started off, worked 15 years at a architectural firm in Indianapolis. Started out in the planning department and did a little work with FM with them, and did some basically some process stuff with them as well. And then last 6 years I've spent with IU Health. Started out with just doing documentation, writing standards and that, and started asking questions about why we're still flattening our models and creating back to AutoCAD, and we decided that we wanted to move forward with BIM, and so at that point we started creating our BIM guidelines.
Yeah, so let's start there with IU Health. Our first interaction with IU Health was at the Cincinnati BIM User Group, where you were presenting on some of the initiatives that IU Health was undertaking with the BIM plan. You talk a little bit more about why you started embarking down that path.
So for us, it was about just being innovative with how we used the models, and the industry. We expect our designers and our contractors to utilize BIM to be efficient with our buildings and make sure things are right, so that they don't add cost to our projects with things like clash detection and what have you. And through those discussions with facilities and the design and construction staff and some of our contractors and designers, we decided that that's something we need to start doing, is to start thinking outside the box and from what we've always done, to utilize those models to help we as a system at IU Health to be more efficient with how we manage our buildings.
Right, and so speak a little bit, how are you using building information modeling today?
So we today have a fully blown or intact BIM guidelines that we created that basically helps us to put out there for our designers and our contractors what we expect to receive at the end of the project. We try to make sure that as we put those guidelines out there, we're intentional about not getting into, trying not to get into too much means and methods, but we are very intentional about saying what we expect to receive at the end. We want to have things like, we want to have our engineering information into the model as parameters, so that we can put that into our CMMS programming. Things like capturing the information on the equipment. So I've worked closely with our enterprise asset management team, which has been a huge help to me, to just put our COBE template, or our COBE requirements together to make sure that we're capturing through COBE, which is Construction Operational Building Information Exchange, to use those international standards to capture our data, so we get consistency of how we're calling out our equipment, so that then we can also use it to manage those pieces of equipment. Mainly what we capture through COBE is the location, so that then the facility guys can find the piece once they go to a room when they have to do a piece of, do some maintenance on something, cost, so that we can help with our budgeting, and then warranty information. That's huge. I mean, we were having issues with managing our warranties as a system in that, and so we're excited to be able to utilize that for that piece to help us to be more efficient. But it's really things like that that we found were beneficial to us, that fill some gaps, is how we use the COBE information. And then just being able to, I mentioned the engineering stuff, just be able to have the loads and if it's a positive or negative air pressure room, and being able to highlight on our floor plan easily, and by basically pushing a button. Not quite that simple, but you know.
Right.
But having it into a database where we could do that, that's a huge deal, and that's kind of what we've worked towards, and that we're doing now. And then there's the space management stuff too, just being able to manage our facility with the space and what have you. So
Yeah, I really admire the appreciation you and IU Health has on the information, on the I in BIM.
Mm-hmm.
Yeah, I think that really unlocks its potential. So I guess looking forward in the timeline, you spoke a little bit how you're using BIM today.
Mm-hmm.
How do you see it in the future at IU Health?
In the future, what we're working towards is basically making sure that we're capturing the COBie information at the appropriate time. So short term, we're getting close to it. We've actually had our first project where we had that information at substantial completion and had it into our systems. Pretty exciting that we were able to do that, but we still have some work to do. We're not quite there yet. Another part of our vision is just being able to manage our buildings from a standpoint of capacity. We actually are putting people where they sit at so that we see where there's vacancies, and then understanding departments as far as where they're located and things like that, just to help us to better manage the buildings themselves so that we don't have people in an area that there's too many people in there, and then other areas where there's a lot of extra space that's just not being used efficiently. So in that way, it helps also with cutting down some of our construction costs, because we're not having to renovate thinking that we need to add space when there's space in another area that they could be using for that. So long-term vision, we're trying to basically just get it to where our leaders are just better informed using the models and having that at that model information at their fingertips. So whether it's through a web portal or what have you, that they just are able to take the information that I spoke about and be able to pull it up and see what we have and be able to make better informed decisions, so that we can be more efficient with the dollars that we have, and we can keep as much dollars towards patient care as we can, and not as much on construction.
Right. That makes sense, putting it to the core of why IU Health exists, and then also eliminating some risk and replacing assumptions with informed decisions.
Yep.
And so maybe if you take that perspective that you have at IU Health, and maybe let's zoom out to the industry at large now, whose responsibility do you see it is to push some of these types of strategies, these data-driven strategies, into the industry?
So the way I look at it is it's really all of our responsibility. So for us, it was a collaboration of our design partners, our contractors, as well as internally the facilities group, the enterprise asset management team who manages our equipment, and then of course the design and construction team that I have around me that support me and help me out greatly with what they see on a day-to-day projects and that. So it's coming up with, when they see something, bringing it to the table, letting us vet it, see if it works for the way IU Health works, and if it's worth the investment and the time that it's going to take to do that, and just doing what's in the best interest of IU Health, and making sure that we're not adding information in there that just becomes clutter. So that's the vetting process that I spoke about, is that you gotta make sure that the information that you are putting in there is what you're going to use. And I like to say no more, no less. So, and that's the tough balance, but that's how you get there. So, and sometimes you got to pull it back a little bit and figure it out, because sometimes you're still putting, even though you're trying not to, you end up putting more information in there than you need to.
Data is a means to an end. Data with a purpose.
Yes.
And so if you take some of what you've learned and what you've accomplished, there's a lot of building owners that haven't really even started, or maybe that they understand what BIM is on a fundamental level, but they're not implementing it. What advice would you have for someone who is trying to implement BIM for the first time as their first steps?
So the steps that we took to help us as we got started, we reached out to another hospital and asked them if it was okay if we used their BIM guidelines just as a starting point, and that was a great help. because that gets rid of, doesn't get rid of, but it at least puts it on the table as far as some of the detail that they've already gone through. And that's the great thing about the BIM community is that they like to collaborate. They like to help each other out, and I've found that in many different ways. So as you get those guidelines though, start looking at what fits for you. Where do you guys have your gaps or where you're not understanding what it is, and being okay with reaching out to somebody and having that connection to be able to do that. And then on the other is just figuring out your standards that fit with those guidelines as well. So for me, we already had a room numbering standard, so that's part of the BIM guidelines now because that's an important piece of the construction process. We're creating room naming standards. That's part of that because that's important with projects as well. But then also just being real intentional about I talk about means and methods and not. You want to be clear to your contractors of what you expect to and designers of what you expect to receive, but don't get too much into telling them how to do their job. Is important to them as well, because one thing that does is add cost to your project if you go down that route. But with our BIM guidelines, we put in there what we expect to receive at the end. Though we're very clear on that. We're very clear that the models are ours. And they know what to expect this way, which is really important. I went to the BIM forum a couple years ago, and I heard that over and over again. Owners want BIM, but they don't know what they want. They have to know what they want. They have to know how you're going to use it so that they know that what they're going to deliver to you is what they need.
It's well said. Any other general advice you'd like to give other building owners?
It's a process. I've been working on ours now for 6 years, but we started off. We knew that what we started off with was pretty good, but we didn't become content with what we had. We've continued to look at what do we need to do to make this better, and we're open to listening to. Things that are working, things that aren't working, and we adjust. It's a living document. It has to be a living document. If you think you can create it and be done with it, you're wrong. I do an update on our guidelines about every year and a half. So we just finished one in January. And we expect to, we're trying to get everyone's contracts amended now. It's a painful process, but hopefully by April we'll have that all amended in that and be able to move forward with the current version that we just came out with. But so it takes time, and and you just got to continue to keep your mind open to new ideas and be ready to adjust as you need to.
It's often referred to as a journey. It's a true
journey.
Statement.
Yes.
Well, I really appreciate you taking the time, driving down here and having the conversation with us.
Yep.
Anything last that you'd like to share?
No, just don't get discouraged, and it's doable. It just is going to take a little bit of effort, and don't be afraid to reach out too. I mean, I talk to different hospital organization and university and organizations on a regular basis. So just bouncing ideas off of each other to figure out what we're doing, as well as I will talk to different contractors and designers in that, and ask them, what's working, what's not working, what do you see coming down the road that could be helpful to us. That's a key part of it too. Just constant communication, internal and external, to really get to where you need to be at, figuring out what works for you.
Excellent. Well, again, Toby Kelly, BIM Manager, IU Health. Thank you so much for joining us. It's been a pleasure.
Thanks for having me.